Okay, hello everyone. Thanks so much for joining us today. My name is Dan Gelman. I'm the Senior Director of Marketing at High Focus Centers. I'm here today with my colleagues, Sel Fundicelli-Cox, who's our Senior Business Development Representative, and Jackie Bramble, Community Liaison for the Cherry Hill location of High Focus. So today's presentation is for our colleagues out in the community who've been such amazing partners over the years. Over the past 7 or 8 months in particular, we felt incredibly supported by all of you. These relationships are what makes the treatment continuum strong, and we need to continue to rely on each other, ultimately because it's in the best interest of our clients. So this means that we count on you to understand what's important for us to be focusing on. And what we've been hearing is an overall curiosity about virtual treatment, especially virtual treatment at the IOP, PHP levels. We're also getting lots of questions about seeing clients on site, which presents some unique challenges when hundreds of patients are coming in and leaving our locations every single day. So there's a few things we want to accomplish today. First, we want to give you an opportunity to meet some of our clinical team, and especially some of our leadership on the substance use treatment side. You'll get some firsthand information on what the SUD programs are looking like right now, and how we've been able to offer a clinically sound, engaging program despite some of the challenges of virtual treatment. We also want to share some data with you. We had to quickly learn how to become experts in delivering IOP and PHP treatment on a virtual platform. Now, to my knowledge, that had never been done before. So to be transparent, we scrambled for a few days, but the clinical teams at High Focus have been amazing. We've really honed in on outcomes and client experience specific to virtual, and I'm excited to share with you what we've got as far as data. So aside from where we're currently at, we want to talk about where we're going and how we'll continue serving the over 5,000 patients we admit to our programs every year. We live in unpredictable times, but we'll give you some updates on the direction we want to move in, how we plan on getting there. So last but certainly not least, we plan to raffle off 4 $25 Starbucks gift cards for those of you who stick around until the end. The one housekeeping item to keep in mind is that we'd love to hear your feedback or get your contact information in the chat box. It should be on the right-hand side of your screens. And when we do the raffle, we'll be pulling contact information from that chat section in order to get the winners. So thanks again for giving us an hour of your time. We'll hope to stay under that 60-minute mark. And at this point, I will hand it over to my colleague, Jackie Bramble.
Hi, everyone. High Focus Centers has been an established treatment provider for over 25 years. We were one of the first standalone, non-affiliated with a hospital system to become Joint Commission accredited. High Focus Centers is also duly licensed for substance abuse and mental health treatment. Our leadership team comes with years of education, expertise, and experience within the treatment industry. Given our strong foundation of consistent evidence-based clinical structure, we were able to pivot very quickly when the COVID-19 crisis hit. High Focus Centers has always valued remaining progressive, and we're always looking for new ways to engage our clients, and this includes the use of technology. During COVID-19, we still saw it as essential for those struggling with addiction to still be able to receive strong, clinically excellent treatment and outstanding quality of care without risking exposure to the virus. High Focus Centers was prepared with an exceptional protocol for treatment, as well as a HIPAA-compliant telehealth platform in place. Within just a couple of days of going shelter in place, we were able to transfer all of our levels of care and our assessments to our new virtual way of operating. Remaining consistently accessible to our community remains one of our top priorities. Throughout the pandemic, substance abuse has spiked. So we see it as vital to respond with a sense of urgency when someone is seeking treatment. Our intake department is available 7 days a week to be able to schedule new or returning clients for assessments, and all 8 of our locations are able to begin a person in treatment within 48 hours. Our community liaisons and our leadership team have heard questions asked amongst the community as to how exactly are we providing treatment during this time. This is one of the reasons we wanted to provide this opportunity today to provide updates utilizing this forum. I'm going to now segue over to Lacelle, who is going to share a closer look as to how we're currently operating and what our future plans are.
A lot of our traditional services at High Focus include anything from partial hospitalization for mental health, dual diagnosis, substance abuse, intensive outpatient for mental health, dual diagnosis, and straight substance abuse, IOP, day and evening programs. We begin treatment just by conducting a full biopsychosocial assessments. And our groups include recovery skills groups, didactic groups, open process groups. We also have a robust family program and offer weekly individual therapy sessions. We also offer psychiatric sessions and urine drug screens, which continue to be on site. This is pretty much an overview of our traditional programming that we've done for many years. And then something happened in March. As we all know, everything changed. In a very short amount of time, High Focus quickly pivoted to a virtual platform on Monday, March 16th. And we've been in this platform for the past 7 months. In the last 7 months, we learned a lot in telehealth during telehealth treatment services, and we continue to learn. One thing that we learned quickly was that we could deliver services that patients were satisfied with and that still met expectations from engagement and outcomes perspective. And because of this, we've been in the fortunate position of not needing to rush patients back on site and expose them or our staff to unnecessary risk. Currently, we're still seeing our patients virtually. But as people have gotten more comfortable, we've integrated the ability to have some of the one-on-one sessions in person and on a case-by-case basis, which brings us to phase 1. We're prioritizing the highest risk patients, but also when possible, accommodating patient requests. Our goal is to stay nimble and to stay flexible. Caring for our patients and employees is and always has been our number one priority. And understanding that the environment may change quickly and we can remain flexible is key to avoiding any interruption in treatment. We're thinking about moving into phase 2, and we're measuring all of the current CDC guidelines. And this is what phase 2 would look like. As state regulations and overall community sentiment evolve further, our goal is to be ready with a hybrid model to treatment. With adolescent programs to go along with adult mental health and adult substance abuse programs, we've had to carefully think through how we can limit patient flow throughout our buildings at any given time by staggering schedules and break times, etc. We are restricted to 25% capacity within the site and within each room in that site. When we begin phase 2, we'll be limited to a smaller group of people, maybe 6 or 7 to a group. We are in the process of installing clear dividers in our consult rooms so that safety is the number one priority, and these interactions can regularly occur. This would mean assessments, individual sessions, and psychiatry sessions. Currently, these sessions can all happen in the group room, which are larger, but in phase 2, we'll need to use those rooms for larger groups. Our group rooms are being set up to be virtual group rooms. Once these are in place, we would have the choice of our smaller in-person group begin entirely in person or connected virtually to other patients who are participating from home. Executing treatment in that way is new and challenging. We won't begin until we've practiced and worked out any glitches. So the question is, when will we go to phase 2? Again, we are constantly monitoring CDC guidelines as well as state and local directives on social distancing. We're also closely monitoring the schools and what they're doing and how these processes are going. And some of them are now having more students on site. Ultimately, we're committed to getting patients back to our programs at our sites as soon as possible. And we're getting really close. So as we continue to hear that in-person treatment is a priority to some folks, we also know that the majority of people are doing really well via telehealth and virtual treatment. We have some data that supports our process for delivering our programs via telehealth, and that it's adequate and that extremely effective. For that reason, our plans for the foreseeable future still involve virtual treatment to some degree. What you're seeing is a virtual substance abuse IOP, PHP, from March 2020 to present. These are the numbers of telehealth events we've had. How many hours patients have spent in group therapy? How many family therapy sessions there have been? How many level of care assessments we've conducted? How many psychiatric evaluations have occurred? And how many medication checks and psychiatric follow-ups have been completed? This is basically showing you the volume of treatment and sessions and patients we've seen since March 16th on a telehealth basis. I hope this gives you some idea of the work that's been put in by our highly trained clinicians and our staff overall. Dan Gelman, I'm going to introduce now, who is the Senior Director of Marketing here in New Jersey for High Focus. He's going to tell you a little bit more about the outcomes based on client feedback and data that we've collected over time, from the time that a patient has their initial visit to the time that they discharge. Dan?
Thank you, Lacelle. And I think that this slide really does a great job at just conveying the massive scale at which we've provided virtual treatment at the IOP PHP level. It's pretty astounding, especially because prior to COVID, we had no plans on doing this. But going to the next slide, one of the things that we value most at high focus centers in general is the collection of objective data. We collect and analyze data on everything. When we started operating virtually, we knew we were going to have to refine processes, challenge ourselves with engagement, and get better fast. So we devised an additional questionnaire for clients to fill out specific to their telehealth treatment experience. Early on, we worked through some technology issues and the natural impact of our team adjusting to a completely different way of providing services. In March, we were generally scoring mid to high 80s on these questions, on these measures. Again, we were giving these questionnaires to clients once a week throughout the course of treatment while they were in the virtual IOP or PHP. So we were getting mid to high 80s, but through ongoing performance improvement, we've been able to drastically improve that experience. So just to give a sense of what we see here, 93% of patients in between March 2020 and now feel that telemedicine or telehealth services are an acceptable way to receive healthcare service. 93% of clients feel that they're developing the necessary skills to manage their symptoms or recovery successfully through telehealth. And 92% of clients were satisfied with their overall experience via telehealth. So as you know, engagement is so important to treatment and the recovery process. It's the number one concern we hear from professionals when we talk about telehealth. How is the clinician able to develop the therapeutic relationship? How can the clients benefit from group therapy when it's virtual? So this data indicates that our team has been able to do it. We've been able to engage. 92% of clients were satisfied with that overall experience. 93% developed the skills. That speaks to some of the efficacy, some of the outcomes. They were able to develop the necessary skills to manage their symptoms. 93% thought telehealth services were acceptable. We're getting outstanding feedback on that. Another thing that is so important to treatment is the answer to the question, do the clients like it? And this data clearly indicates that the vast majority of them do. The other and probably most important item to look at is clinical efficacy. So looking at evidence to determine whether this mode of programming actually works. So at HighFocus, we administer the Basis 24 to patients, both at the time of initial assessment and at the time of discharge. The Basis 24 is the Behavior and Symptom Identification Scale. It asks a series of questions that assess symptoms of mental health, substance use, and overall functioning. Now, there's actually 4 specific questions related to substance use, which is what we're talking about, where the client is asked specifically about how many times in the past week they've experienced urges. So what's the frequency of urges? How often someone has spoken to them about their use, how often they've hidden their use, and how often their use has led to problems. So those are the 4 substance use disorder specific questions, and that's reflected in the lighter green line that you see on the graph here. So, but overall, this graph reflects only our adult substance use treatment population, so none of our mental health patients. And this graph shows the average rate of symptom improvement specific to the clients in our substance use programming based on on several categories: substance use, depression, functioning, emotional ability, and relationships. So if we combine all of these categories, our substance use patients had an average rate of symptom improvement of 47%, which is really, really good. When we look at the specific substance use questions, we see an average rate of symptom improvement of 70%, all through virtual IOP, PHP. It's astounding. So when we compare this data to some of our pre-COVID, pre-telehealth data, it isn't just comparable. We've actually found that because of the elimination of barriers, rates of attendance have gone way up. And in many cases, this has led to better outcomes. So they're showing up for group more regularly, and they have the opportunity to benefit more from their program. So the long and short of it is, because we have so much evidence that virtual programming is working really, really well, we know that with some cooperation from payers and licensing entities, which we think we'll get, we have to continue offering IOP, PHP on a virtual platform in some form for the long term. So what we want to do now is dive in a bit on the clinical side and see exactly what it all looks like. So at this point, I'd like to introduce you to our Clinical Coordinator of Adult Services in Lawrenceville, Jamie Farkas, Clinical Coordinator of Adult Substance Use in Cherry Hill, Jamie Tanda, and our Community Liaison in Cranford, Beth Balaban.
Hi, everyone. So I'm going to take some time to talk about a week within HighFocus Center's substance use disorder, PHP, and IOP program. So our programs right now are run virtually via BlueJeans via a HIPAA-compliant platform. So I'm going to explain a little bit about the mechanics of BlueJeans. Which is great that we have the ability to see up to 30 people on screen in tile form while involvement within the BlueJeans group setting. What's great is also there is an ability for individuals to raise their hand to begin participating in the group setting to allow for group cohesion and group participation. The clinicians and clinical staff are able to share the group material virtually via the screen sharing feature on BlueJeans, while also providing this group material via email to the clients. When we were in person, we were providing our clients their own binder of resources and group information. So this is a way to allow the clients to still be able to print out the information and save the material being reviewed in the group setting. Something that is great that we have started is working on and completing a relapse prevention plan upon admission into our chemical dependency program. So these relapse prevention plans focus on early warning signs, triggers, supports to utilize, and specific distraction techniques and skills to implement to reduce the thoughts or urges to use and work towards ongoing sobriety. These relapse prevention plans are utilized weekly in both the group and individual session, and we continue to work to improve and edit those relapse prevention plans. Next, and importantly, is engagement. So there are a lot of engaging groups that follow an evidence-based curriculum focused around topics regarding relapse prevention, social support, mindfulness, and the utilization of healthy coping skills. We have found in the group setting that some of the clients' favorite groups include talking about acceptance, willingness, having fun in recovery, cult, boundaries, and self-sabotage. We really take a lot of time to work and listen as to what the clients feel they need in the group setting and how to apply these group materials in the virtual setting via BlueJeans. One of the components that we utilize in the group setting is called our pulse. So we take the pulse of our group and all of the individuals in the group on every day. At this time, it gives the clients an opportunity to speak to the number of days since their last substance use, if they're experiencing any thoughts or urges or cravings to use, and the number of meetings that they have attended in this treatment week. What's great about the pulse is it allows for accountability and follow-up, both from the peer-to-peer setting and also clinician to client setting. We put a focus on following through with goals and items that have been identified as important factors in their treatment plan. And something that the clients really like to do is to stack small wins with their peers and their staff and really build on the importance of laying the foundation of these small wins that they're achieving in and outside of the group setting. Something that we really strive to build and focus on is the therapeutic alliance between the clients and the clinical staff, and really take the time to build the rapport, to build the connections that can be done pretty easily in the individual face-to-face setting, but also allowing for opportunity to laugh and to get to know each other and to really connect on a personal level. So next, taking time to focus on the interventions that are used in the group setting. As I said, we follow a curriculum and we really try to tailor the group material to client needs. We recognize the need that they find, whether it's focusing a little bit on communication skills or utilizing relapse prevention techniques, or also just ways to practice mindfulness and grounding when having thoughts or urges to use. Some other interventions that we have used in the group and individual setting include monthly challenges. So one that we have done recently is a self-care monthly challenge, practicing and identifying coping skills of the day. So focused around when individuals are finding it difficult to manage their thoughts and urges, but also how to manage some emotion dysregulation. And also we are providing resources on a weekly basis to our clients regarding podcasts, YouTube videos, recorded meetings, support services, TED Talks, and also some articles regarding recovery and sobriety. One of the most important resources that we have strived to focus on is the importance of our weekend planning group. So this group is usually done on a Thursday or Friday, and it takes the time to focus on the skills and topics that were learned and reviewed during the treatment. And this time is to explore what potential barriers might come up over the weekend or potential concerns for sobriety. And it allows the group to really talk about strategic ways to implement skills over the weekend when not in group, as we know that our clients spend a very small amount of time in program with us in comparison to time outside in the real world, whether with family, with friends, at work, or school. So really taking the time to utilize client-centered interventions and approaches to telehealth virtual treatment. So that is all I have, and I am going to pass it over to Jamie Tanda, the Adult Chemical Dependency Clinical Supervisor.
Thanks, Jamie. Hi, everyone. It has always been our mission at High Focus to provide the highest level of clinical care to our patients in order to really maximize their results of their treatment experience and to set us apart from our competitors. We attribute our high level of clinical care to the experience of our clinicians and supervisors, the structure of our treatment programs, and our ability to create flexible, individualized treatment plans and schedules that accommodate our patients' unique recovery needs. We fully endorse and encourage MAT treatment as a way to further strengthen recovery programs for our clients. And we allow admission of clients who are already on MAT prior to admission to High Focus. And we do have the ability to collaborate with a lot of prescribers in the area, and we do have long-standing relationships with many in the community. As Jamie mentioned, we do have a brand new curriculum that was updated about a year ago and converted to a digital platform. We have the ability to share our screens, like she was saying, for our education and skills groups, which really does help the group stay focused and run smoothly. We've always endorsed evidence-based treatment modalities to ensure effective treatment, specifically motivational interviewing, DBT skills, CBT skills for our substance and co-occurring populations. Our telehealth platform and curriculum does provide the same high clinical standard that we were providing to our patients during in-person treatment. And as I mentioned, we do have a flexible schedule to meet everyone's needs. We have different schedules and options that are really kind of crucial to be flexible now more than ever during this complicated and stressful time we're all going through. We do offer both day and evening programming for IOP treatment and the ability to utilize some Saturday programming at certain sites. And we have allowed patients to do a combination of day and evening treatment if that's what their schedule requires. And it has been successful as long as we communicate openly with the entire treatment team, which we do on a regular basis. We have daily team meetings. So as we said earlier, we have clients present to our site to submit their scheduled urine drug screens to the closest High Focus Center site to them. But if a patient is unable to present to the site at the allotted days and times that we have available, we can write a script to the nearest Quest location to their home, and they can provide the sample there. We have incorporated several new processes to increase engagement and increase the safety of our patients during our telehealth treatment model. We schedule a pre-group individual session for all of our new admissions to screen for safety concerns, iron out any lingering IT issues, and review safety planning or relapse prevention planning prior to them starting treatment. During this session, we're also able to review and confirm the safety of their home environment before they start treatment. And this pre-group session is normally scheduled right after the intake assessment, but before their first scheduled group session. We do utilize group, individual, family sessions, and weekly collateral calls in addition to our multi-family night program to make sure we have an accurate read of all of our patients. We've always had a multi-family night program, but we did convert the program to a telehealth model. And this has allowed for an increase in attendance at some sites because of availability to family members. Particularly, I think those family members who live far away or out of state and want to be involved in treatment, but when it was in person, they weren't able to do so. And our family program focuses on educating family members on how to better understand and support their loved ones struggling with mental health issues or addiction. All right, and lastly, we do encourage our clients to have a connection to the community. We feel it's essential for our clients to get connected with outside recovery communities in addition to their clinical work at High Focus Center. We do encourage 12-step meetings, SMART recovery meetings, refuge recovery meetings, Dharma recovery, Celebrate recovery, and honestly, any support group they're willing to attend, we encourage it. One benefit of this pandemic is the ability for our clients to easily try out these different support groups online, which wasn't necessarily an option before, but they have opened up a lot of online availability with this pandemic. So I'm going to transition to Beth now to further discuss our High Focus Center app and Facebook alumni page, which is another way for our patients to stay connected when they're not actively in treatment program.
So we do have the app for our patients, and it's nice that they're able to access the app while in treatment so that they can get used to it while they're getting to know their therapist and the other people that they're in treatment with. When they graduate the program, we have a different version of the same app that is set up for all of our alumni. There's a gratitude journal. We update it regularly with recovery posts, podcasts, events, opportunities for volunteer work, and also different meetings that we find within the different modes of recovery. We are also working on getting our alumni meeting back up and running as we speak, which is really very exciting. It's a great way for people to stay tethered to something that's comfortable while reaching out into the community on their own to solidify a network of people they can continue to be accountable to, as well as open and vulnerable. Another wonderful aspect of our Alumni Association is that once people get really firmly rooted in their communities, they can reach back to patients that are just graduating and help them do the same thing. So we're going to start out by meeting once a month, and then hopefully, if it goes well, we can grow from there. And I believe that I'm going to be handing it back over to Dan.
Thank you guys all for giving us that information. I think it's really interesting how High Focus has been able to be flexible and be able to really have an overall theme of meeting the clients where they're at, instituting all different kinds of interventions to try and best engage. But it's all grounded in really strong, consistent treatment protocols and curriculum that we know work. So it's kind of combining that, the going above and beyond on the engagement part with the evidence-based, strong backbone to the treatment protocols that we've always had. So thank you guys. With that, I'd like to now introduce some of the folks in our Northern New Jersey contingent. Paramus Executive Director Michelle Lane, and also from Paramus, our senior clinician, Shanta Worley.
Hi all, it's a pleasure to be with you today. Earlier, Jackie spoke of our 4 pillars: experienced, clinical excellence, progressive, and connected to the community. You will find that these 4 tenets are within our specialized treatment as well. Since we are a substance use and a mental health provider, we have the unique ability to provide individualized care for our patients who have a co-occurring disorder or who have experienced trauma. In 2018, 9.2 million adults were diagnosed with a mental health diagnosis and a substance use disorder. With that overwhelming number and our opiate crisis, we at High Focus Centers look to provide services to this population and their ever-growing needs by having these specialized tracks, as well as flexible scheduling. An individual coming to treatment would have the ability to have a group schedule tailored to their individual needs. This could include utilizing flex scheduling, where someone would be attending groups in both our substance use program as well as our mental health program. It would also include meeting weekly with our psychiatrist, attending co-occurring psychoeducation, as well as smaller process groups that would focus on both their mental health and substance use diagnosis. So what does that really look like? That would look like if Jane came in for services and was identified as needing our IOP program. and she was within our treatment program for a few days a week. And as we got to know her, we found out that she had depression in addition to, her alcohol use. We could then say, you know what, Jane, we feel you need to, individualize your day a little bit, and we would like you to go to our relapse prevention group for co-occurring disorders after you've done your substance use process group. We would like you to join our co-occurring process group 3 days a week. We really have that flexibility to almost develop like what I look at as a high school or a college schedule, where we can fit their needs based on what our group curriculum is, as well as those topics. And folks can have that tailor-made schedule. You've heard about our ongoing commitment to excellence in the care we do provide. So with regard to that, we also participated in the Co-Occurring Learning Community Project, which was conducted by Rutgers and New Jersey Division of Mental Health and Addiction Services. They worked with our team, evaluated our protocols, and provided feedback. We received a score of 4.22 out of 5, and were recognized in the state of New Jersey as dual diagnosed capable enhanced. So we want you to feel comfortable when making those referrals, that we have this expertise and that we have this ongoing commitment to our patients and our community. Now I'd like to talk a little bit more about our specialized treatment with trauma as well. Again, another stat, I like stats. So we have 8 million adults each year diagnosed with PTSD. There's also another statistic that trauma and PTSD increase significantly of up to 10 to 20% after a pandemic. Other countries saw this with SARS, H1N1, and we at High Focus wanted to make sure we were prepared to meet our community's needs. We began our specialized treatment for trauma in late 2012 and launched tracks in both our Paramus and Freehold locations. Recently, we looked at our community's needs and expanded our programming to include Lawrenceville and Cranford. We provide programming at 2 different levels of intensity. Both of our tracks will have group and individual sessions, as well as weekly sessions with a psychiatrist or medication management if needed. In our one trauma offering in Cranford and Lawrenceville, we look at providing trauma-specific education and skills groups within a broader mental health IOP. Patients in this track will attend their trauma-only groups multiple times a week. Now, I know I mentioned mental health IOP. This does not preclude our folks who are in our substance use disorders programs. Again, with that flex scheduling, we are able to pick what groups our patient would need and individualize that for them so that they would be able to join that education and skills group. Our other level of training trauma group is a little bit more intense. It has 6 to 8 specialized groups per week. And we are focused on doing a specific trauma curriculum that provides education, coping skills to manage symptoms, and a closed process group for only trauma patients. Again, we've had our substance use folks be able to participate initially in those education and coping skills groups, and then, if appropriate, transfer completely into the trauma program where they would benefit from those very small closed process groups. Regardless of the level of care at Cranford, Lawrenceville, Paramus, or Freehold, all of our folks will be getting group services, individual services, family sessions, psychiatric services, and our core elements of treatment. This is integrated in our approach, managing responses to triggers, creating safety, boundary setting, and the impact of trauma on our neurochemistry. Thank you for listening about our specialized programming at High Focus, and I now turn this over to Shanta Worley, who will discuss the mind, body, and spirituality connection for our patients.
Hi, everyone. Thank you for attending. So we at High Focus, we also have a kind of a holistic approach as well. Finding peace of mind and recovery, yes, it begins with treatment, but it also extends way beyond. It's finding balance of mind, body, and spirit. Each serves a purpose in making the journey for recovery worthwhile, and because each has been affected during substance use. You know, the brain is one of the strongest muscles we have. Unfortunately, during active addiction, it becomes to some degree the weakest. And so the ability for the mind to function at its highest capacity is definitely compromised, which is evidenced by the chemically dependent person's inability to make healthy decisions and their lack of judgment, just to name a few. Strengthening of the mind comes during the process of recovery. The CD person is able to think clearer once you stops and begins to gain better understanding of actions and behaviors that impede the recovery process and their efforts. COVID-19 has had a devastating impact on people who are struggling with recovery, our frontline workers, our essential workers, and they're turning to alcohol and substance use at higher rates. So even though there are some restrictions that are being lifted, we are still in the beginning processes of returning to what we thought to be normal, and we are still currently in the process of learning how to adhere to new norms. Some of the things that we at High Focus recommend is to try and strengthen the mind and help the mind become strong and functioning. And part of those suggestions are, going to AA and NA and smart recovery meetings. The mind can still absorb information, and it feels better knowing that others are experiencing or have experienced the same situation and overcome. Reading material, definitely suggest that, whether it's the big book, the Just for Today, the basic text. Even if you can't make a meeting physically, then we definitely suggest to our patients that they get on Zoom and even get out of bed, go read before bed. It helps to help you to fall asleep, help you to relax, and ease some of the tensions off the brain. And again, a little bit of something from recovery is better than nothing at all. We also suggest to them that they remember to breathe and not catastrophize. That's something that the brain can do with the smallest of situations. We also remind them that knowledge is power. Not all of what we see right now, especially in the media and just hearsays, are true. There are a lot of people who are dying, and it can be overwhelming to the mind, and it clouds judgment. So we ask them to look for some of the positive things that are coming out of COVID. Unfortunately, there's not a lot, but there are some. Many people are recovering from COVID, which the media doesn't always report, or they report it minimally. But they definitely report, it's on the forefront how many have passed away. So we got to try and remind them that even though this situation is kind of an unknown and we're going through it kind of blindly, we're still all in it together. Use journaling to calm thoughts and feelings. Sometimes going from your mind to the pen and just jotting things out for them can be really good for them. Also, we also recommend that they use mind puzzles, crosswords, Sudokus, anything to help them to strengthen their mind. Guided meditations. It takes moments to restore calm and tune out distractions. Sometimes it's just sitting down, being still, and being quiet. And we also recommend them to remind themselves that they're doing the best that they can, that they didn't get here where they are overnight. And so we remind them that, it took time for you to get here, and it's going to take time to recover and build back all that has been lost. So as far as the body is concerned, we definitely, in keeping up with that holistic approach, we definitely recommend that they get a physical. So with COVID, some more than others, with addiction, some more than others have beat their bodies up or neglected their bodies during active addiction. And that's why we recommend them getting a physical. This COVID quarantine has taken its toll on most people, and some have gained at least 10 pounds. Well, okay, maybe 20 pounds. But everybody's gained some weight from this COVID and being quarantined. So we've all heard the saying that a body in motion stays in motion. So just like the mind, the body needs to be strengthened and needs to be remolded. So we give these suggestions about their bodies and getting back on track and getting back to good functioning. We suggest that they get 8 hours of sleep. That is the way for the body, the mind, and the body to refresh itself, to rejuvenate itself. A good night's sleep helps regulate the body so that you can feel like you want to get up in the morning and get started. We recommend that they eat healthy. During COVID, there's probably been a lot of snacking and late nights and just being off with timing and stuff. But nutrition hasn't been at the top of the list. And so now we're encouraging them, now that you're back and you might have returned to work or just, going back to some daily functioning, overeating and undereating is not healthy. And so incorporating fruits and vegetables and healthy proteins, watching out for all those carbs that people like to ingest. We're recommending those things. We're recommending smaller meals more often. Sometimes, if you are into exercise and stuff, you need at least 5 to 6 meals per day. So we're really giving them some education about their bodies, how this quarantine has impacted. And so we're encouraging them to hydrate because water is the best medicine for the body. 8 glasses of water or more per day. And we're encouraging exercising, even if it's just getting out and walking half a block. It doesn't have to be something that's long and walking a mile, but just doing 10 minutes, maybe around the block one time, will help build up, those feel-good endorphins. And maybe that'll encourage them to want to do more and go into the gym. So the other thing that we like to talk about is the joining of spirit and how that plays a role in our motivation. So some people confuse religion with spirituality. Spirituality is that realization And some things can't be controlled and are amazing. And I like to use this time of the year because there's something that is truly amazing that's going on around us. And that is the changing of the seasons. But when you look around at the leaves, you can't help but be amazed at all the wondrous colors that are happening. And so it's that value of not something that's materialistic, but something that you can't control. The sunset, the sunrise. It Spirituality is having an attitude of gratitude and gratefulness for where you've been, where they were at, and where they're going. And so we try to bring that to the forefront and bring them some realization about how the addiction has impacted their lives negatively, but also how it's also in the recovery process, how it's also a strengthening mechanism. It's having hope in what's not guaranteed, but looking forward to whatever it is that's in store. There are no guarantees in this process, and the stages of change tell you that. So you know that you can go through those stages of change and then fall right back into the relapse phase and have to have some interventions that bring you back to life, so to speak. And so we encourage them to take a look at those things. It's also a lust for life that comes after you've been through the storm. And many of the people that we serve, they've been through their own personal storm. And so no one is to judge what that storm is, but definitely speaks to where they've been and where they're at and their survival techniques. It's the rebuilding of life, it's the rebuilding of love, and the desire to obtain it. Spirituality is that lump in their throats when you're an individual and you're talking about something that really matters to them, that's really important. And they come to realize that the way that they were living and the things that they were doing was not healthy for them. When they have that quote unquote in the big book, that rude awakening. And then they come to realize that through going to AA, NA, smart recovery, treatment, and all its different levels, whether it's PHP, IOP, OP, whatever it is, that they have a message to give and to share as long as they can stay sober. And they get to show what good recovery is and what it's been for them. So I think all of our clientele have a song to sing, so to speak. And it's a glorious one. And being able to appreciate and hear their stories and knowing that they struggled, but they are survivors and there's more in store for them. I tell everyone recovery is an action word. It requires you to do some things to gain momentum. And so whether it's utilizing cognitive coping skills, behavioral coping skills, there is something to be said about being able to help them identify those coping skills that they can utilize. That helps get them back to restoring their mind, their body, and their spirits. It's about finding balance during this uncertain time. And that's hard because nobody knows what it is that the future holds. But we are truly hopeful, and we try and encourage them to stay hopeful. And so keeping their minds, their body, and their spirit in a state of homeostasis, which is balance, allows them to gain that momentum, and more importantly, to keep it. Thank you. So I think I'm supposed to turn this over. I'm going to say Dan.
I'm back. All right. Shanta, thank you so much. That was awesome. And, I think the various talks that we got today really do show that it's imperative to take an integrative approach when you're looking to help people find recovery. It's not a one size fits all. We need to be flexible. We need to learn how to pivot when things happen, like when pandemics hit us. We don't give up, and we keep moving forward and doing what we need to do to help patients recover. I think that if you've stuck around until now, you've probably gotten a good taste for our team. Our team is very well educated and knowledgeable. Our team is passionate, and I have so much respect for them and for the rest of our team who couldn't make it today. So I just want to say that if you do entrust us with the care of your patient, know that we're going to give it our all, and you have a really competent staff that takes care of anyone that walks through those doors or signs on to our virtual platform. So with that, I think it's the moment we've all been waiting for. I know Jackie and Lascelles were going to take the lead on the raffle.
Yes. So we're going to pull four names. In the interest of time, we're going to go through it pretty quickly. If you put your name in the chat, or you have one more chance to do that while I'm speaking, I'm going to pull the first name, and we are handing out $25 Starbucks gift cards, and they will be emailed. So we will electronically send you your gift card. And I'm going to randomly pick and close my eyes and just kind of go down the chat. And the first winner is Courtney Batista from Mindful Life Therapy. So Courtney, we will send you your gift card. Now I'm going to pass it over to Jackie for the next poll.
All right, so the name that first catches my eye that's on my event chat right now is James Johansson from Damon House.
Woo. Go James. Dan, you want to pull the third one?
Is it my turn now? All right, I will pull someone. I'll close my eyes. Point. And the name is Stephanie Hodges. Stephanie Hodges, you're a winner.
Okay. And then one more. So big drum roll for the last one. Thank you all for coming today. Last one is Joanne Martino from Jefferson Township. Joanne, we will send you your gift card. So thank you, everybody.
Yeah, I know everyone's really busy, and I can't tell you how much we all appreciate the fact that you took time out of your day and spent it here with us. I don't want to take any more of your time. Thank you all. Reach out to us. I'll put my email in the chat. Reach out to us if you have any questions, comments, feedback, and we hope to hear from you soon. Thanks, everybody.